Hello everybody, I am Dr. Sanjay Gupta. I am a consultant in internal medicine and diabetology. I have a practice of last 20 years. Currently I am in Bangalore. I practice in BN Hospital and in Prima Diagnostics at Shajapur Road. I have also been actually publishing some papers and writing books on diabetes and patient care management. Medical practice has evolved and come a long way in terms of dealing with patient and diseases. Today, our challenges are different. We are also dealing with loose information coming from social media, coming from search engines, and also coming by word of mouth. So clinical medicine and with all the research-based, evidence-based medicine, the prescription which we are giving the patients, it is about how we are communicating to the patients, and hence I have coined this term as conversational medicine. It is just not enough to give a prescription and let the patient go. The patient is hungry for information. We ourselves are hungry for time so that we do the best to a patient in terms of limited time with the patient. But my question is, today with the emerging technology, today with emerging better e-medicine, how many times are we looking eye to eye with the patient? How many times we have an eye contact with the patient? And how many times we even address what they want to know rather than what we want to give? It is important in this regard that we should communicate and we should have a conversation. We should encourage this practice of conversation with the patient and their relatives, because we know very well that the caretakers are equally, if not more, they are equally important for the patient to take their medicines in time, to have a compliance with the patient, and to make the patient come back if they have any problems, rather than blame the medicine or put a blame game that they did not get the proper effect or they are not satisfied with the medicines. So conversational medicine gives a 360 view about how the patient is feeling about his problems, how the patient wants to deal with these problems when they go back consulting you, and how the family members deal with the problem after consulting you. It is important to carry on this conversation. It is important to actually take the pros and cons at the same time and tell that what is what and why and how. So I think this goes a longer way, because in my practice I have come across for the last decade and more, they hardly bother about reading the prescriptions. We have so much information given to the patient, but if it is not creating an impact, if the patient is not reading what is written and not following what is written, and they have more questions to interpret what you have written, I think we are failing in our job. The practice is to have conversation on these prescriptions as well as on the approach to the patient's problems.